All right, the next question is different pathways to recover and how perspectives have changed over the years. I mean, I could start just with, honestly, I don't want to necessarily talk about treatment perspectives. I'll talk about my own personal experience and perspectives. I remember coming into work in the treatment, substance use and mental health treatment industry and had a very closed mind to a lot of what exists today and how my perspective has seriously broadened. And speaking candidly, honestly, I was like so against certain medications for opioid use disorders, and so against even like calling it opioid use disorders. You're an addict, an alcoholic. You got to own that stuff. You got to identify, and it was a very 12-step, immature approach that I took that didn't have really a clinical focus. It was much more of my own personal experience. And I think my perspective has shifted to a whatever works type of perspective, and understanding that there are medications that are life-saving today that people need to be on, and I should accept that fact. My own personal recovery doesn't have to reflect somebody else's, be reflected in somebody else's recovery.
I went through the same thing. There's videos probably out there of me talking about this 10 years ago and being, on a soapbox saying, nope, it's got to be abstinence only, yep. And not having enough perspective that I've gained over the years to know, okay, everybody's different. If someone has relapsed multiple times, if they've overdosed and been resuscitated multiple times and they're near death, then you have to think about things that are medication-assisted treatments, other ways to use the science to keep them healthy and alive. If you're not alive, you can't get better. So understanding that, and there's still a huge stigma. I've had patients that have gotten better based on being on Suboxone, not a heavy dose, not a euphoric dose, but enough where they're able to live a life and get a job back and have, family in their lives and live healthy without overdosing, with street drugs. And then they go to a meeting where someone says it's abstinence only, and they get pressure over and over and over again until they finally come off it without using their medical provider's advice. And obviously, guess what happens? They end up, they go back and they overdose, and they're right back through the cycle again. So we need to be able to listen and understand what the person's needs are based on their experience. That also means you might not put someone on a medication they don't need when they're new to treatment, and that you understand the levels of care. That there's, not everybody needs to skyrocket to the top and be on meds right away, or needs to go to inpatient treatment because it's the first time that their mothers found out that they're using certain substances. You might be able to do some outpatient therapy, have a recovery coach, get to meetings, and be fine that way and live a great life. And if you're thrown into a higher level of care that you don't need, just because of the first person that you happen to call that tells you that that's what you need to do without a proper assessment, then you might go through, this repeated relapse process where it takes much longer to get better because it wasn't the level of care that you needed yet.
Yeah, all that guilt and shame that's built up, which perpetuates harming yourself more and deepens your addiction. I relate exactly to what you said, Blake, based upon my personal experience and the time frame when I became sober. It was, I believed, a very black and white, but that was before I worked as a professional in this realm. I think that's also an area where, personal recovery is one thing, and then there's the professional lens. Like, I've broadened what I believe in. I've educated myself on so much that's out there, and I couldn't help but get a little emotional when you both started talking, thinking of my best friend that came to where you worked and that who would probably still be here today if things like Suboxone were more accepted at that time. She was a perfect candidate for these new things that are out. Like, it could have prolonged her life. She was someone who had overdosed so many times and lived and really could have lived a really good life on maintenance. And I hate that.
And she was such a sweetheart. She just couldn't stay sober.
This would have helped her so much if this was the way it is now. So I do know that we can save a lot more lives this way. It may not look like what, everyone thinks it should in their own personal recovery, but it's not about that. It's about saving more lives, helping more people, and giving them a quality of life.
A big piece that keeps coming in my head too is and it's kind of cool to recognize, is that we've evolved and we've remained open-minded throughout our careers. And I think if you want to survive when you're treating people with substance use disorders or mental health concerns, that you're going to have to evolve. You're going to have to adapt to the generations and the people that are coming into your care. And you're going to have to remain open-minded to new perspectives and new modalities if you want to survive and actually make a difference in this industry. If not, you could stay rigid, but you're going to become outdated very quickly because this is constantly evolving and constantly adapting.
I couldn't agree more. I love the way that you both learned and the perspective you got from enmeshing yourself in it from both perspectives of being in recovery and working in the field and listening to the feedback and understanding that you got to make changes. And you know, unfortunately, there's providers that still do things the same way as they did 20, 30 years ago, and that's not right either. Yeah. You know, I was reminded this the other day. We have a patient that we referred to a psychiatrist that works with us. And the patient comes back. I said, how did it go? He's like, went great. He kept my meds the same way. And I thought that was excellent because it used to be you would go to a psychiatrist for a new appointment, no matter what, they would change your medications because that was their job.
Yes.
Instead of listening to the patient, and this individual is already stable and doing well, doesn't need that, and the person was humble enough to say, we're going to keep it the same.
Yes, and that's why we like that psychiatrist.
Moving the ego
Yeah.
from it, you know?
Yes.